Good morning, my name is Jimmy Mahan. I'm a DNP student at Texas Christian University. Today I'll be covering a PowerPoint presentation that I created concerning multidisciplinary meetings to decrease the length of stay. Looking at this map, you'll see in the comments, in 2012 there was 36.5 million hospital stays in the United States, with an average length of stay of 4.5 days and an average cost of $10,400 per stay. We'll be evaluating the implementation of a multidisciplinary team meeting to help improve length of stay, and we'll be focusing on a hospital which I currently work at as acute and critical care director at Medical City Louisville. We'll be focusing on the medical surgical unit at Medical City Louisville, which current length of stay on their unit is 5.2 days. Looking at this bar graph, you'll see that Medical City Louisville's 5.2 days length of stay compared to the national average of 4.5 days. The Medical City Louisville is above the national average. The lower the number, the better. We'll be evaluating this process and implementation using the Six Sigma model to help identify the problem and to help problem solve using the Six Sigma methodology called DMAIC. Define, measure, analyze, improve, and control. The Six Sigma principles for DMAIC: D, define, clearly define the problem. M, measure, focuses on how to measure the internal processes that affect critical to quality. A, analyze, focuses on why defects, errors, and excessive variations occur. I, improve, team needs to generate ideas for removing and resolving the problem and improving the performance measures of the X variables and thereby improving the CTQs. C, control, focuses on how to maintain the improvements, including putting tools in place to ensure that the key variables remain within the maximum acceptable ranges under the modified process. So at Medical City Louisville, what we are going to do is define the problem. The problem that we are facing is the Medical City medical surgical unit's length of stay is 5.2 days versus the national average of 4.5 days. We're going to measure this through our accounting department. Our accounting department collects data on averaging all inpatient admissions of length of stay on the medical surgical unit. So looking at this line graph, just for January, February, and March, you'll see that the average length of stay on our medical surgical unit is above the national average of 4.5 days. We're going to analyze what are the barriers to preventing us from discharging a patient in a timely manner. We're going to look at what are the home health arrangement barriers that we're facing. Are there any barriers to placement to another facility, such as rehab, LTAC, or skilled nursing facility? Are there any insurance delays or barriers? Are there delays in tests and procedures? Any social issues or concerns? Are there any barriers with transportation of getting these people home? I, improve. We're going to develop and implement a multidisciplinary meeting to address patients' plan of care daily. So what is the purpose of the multidisciplinary team meeting? Is to improve quality of care being delivered to the patient, improve communication among all disciplines involved in the care, improve discharge planning, and ultimately decrease the length of stay. Who will be part of the multidisciplinary meetings? 1, primary care physicians, unit charge nurses, case management, social workers, physical therapists, respiratory therapists, dietitian, palliative care coordinator, and utilization review nurse. Anybody that's going to be involved in the patient's care will be meeting in this meeting. C, control. How are we going to control this? How are we going to ensure improvement? Overall goal is to decrease length of stay. We're going to have the multidisciplinary team monitor the length of stay and evaluate performance improvement on a monthly basis. So the team will evaluate each month if there is improvement in the average length of stay of the patients on the medical surgical unit. The multidisciplinary team will focus each day on each patient individually, discussing plan of care and discharge planning at 11:30 daily meeting concerning needs or barriers to patient discharge. They'll be looking at scheduled tests and procedures, the insurance needs, progress with therapy services such as physical therapy, respiratory therapy, occupational therapy, speech therapy, any nutritional needs that the patient needs, projected discharge date and any barriers concerning discharge planning of home health arrangements, rehab, skilled nursing facilities, LTACs, any social or equipment needs. So at this time at 11:30, the whole team will meet, discuss the patient's plan of care, and are there any barriers for them meeting their anticipated discharge date. So each individual will focus on any specific area if there is a barrier, and they'll communicate on how we'll overcome the barrier to ensure that the patient is discharged at the potential time that we have projected for them for a discharge date. Currently with insurances and different payers, we are faced with ensuring that we do discharge patients in a timely manner. Because when we look at length of stay, if we looked at bundle packaging or DRGs, we know for a specific diagnosis that the insurance will cover a 3-day stay. So if you are getting paid the same amount, $10,000 for a 3-day stay, anything after that third day, fourth or fifth day, you're not receiving any financial gain from that. So in order to have cost savings, you want to be able to meet that criteria of that potential discharge date. So you want to discharge the patient in 3 days versus 4 days, because the fourth day you're not getting any financial gain for your facility. So looking at how we can decrease patients' length of stay and improve cost savings. Just by evaluating the length of stay and the impact it has on cost savings as per the AHRQ data in 2012, average length of stay was 4.5 days at the cost of $10,400 a stay. Medical City Louisville's length of stay, 5.2 days, costing the facility $1,617 per patient. So just utilizing this basic math, you'll see decreasing the average length of stay to the national average has the potential of saving this facility $1,617. So just implementing a multidisciplinary team can help improve communication, collaboration, discuss barriers that they were any part of the department they're seeing, being insurance, being nutritional needs, being if there's a delay in test and treat, that we can come together, come up with a plan to help ensure we stay on track and on target to ensure that these patients are discharged in a timely manner. If you have any questions, please feel free to leave me any feedback or any questions that you may have concerning this presentation. I hope you have found this presentation of value, and I do appreciate your time. I do want to reference two references that I did reference during my presentation. One was from Weiss and Exhals from the Agency of Healthcare Research and Quality, and the second was a book from Evans and Lindsay, An Introduction to Six Sigma and Process Improvement. Once again, thank you for your time, and I hope you enjoyed this presentation.